All right, thank you for staying with Daybreak. We begin the conversation on COVID-19, the puzzle in the counties, because at the end of it all now, all eyes are on the counties, the devolved units to help the people there within the ground when it comes to the COVID-19 third wave ravishing the areas. They have done a lot, but can they do more? And what are the impediments this far? Joining me in studio now is Dr. Hilary Barchok, Bomet Governor. Thank you so much for making time. And joining me online is Honorable Sylvia Kasanga, nominated Senator. She's online as well. We're still waiting for Mbithe Mwema, an economist, to talk about this issue, but we can continue with this right now. Trevor Mbija at Citizen TV Kenya. The hashtag is Daybreak. We'd like to hear your views. How best can counties go around this issue of COVID-19, especially on the third wave? And Governor, I'll start with you. Let's talk about Bomet. That's where you're the CEO. What are some of the interventions you've undertaken as Bomet to cushion the people on this third wave of COVID-19?
Okay, thank you very much, Trevor, for giving me an opportunity at least to have a discussion on the challenge that we are facing as a country, the issue of COVID-19. So Bomet, just like any other county in Kenya, is facing a lot of challenges because of the COVID-19.
Yeah.
The effect not only affected lives, but even the livelihoods of our people. So apart from ensuring that we secure and ensure that we don't lose lives, we need also to cushion our people on the effects of this pandemic, especially in the economic side. In Bomet, on the onset, we will not just maybe narrow it down to the third wave, but on the onset, we have tried to at least cushion our people from the effects of COVID-19. We have been able to support, especially the needy, with the food. There was a time we distributed over 10,000 bags of maize to needy families. We have also been able to engage at least youths in giving us services in the community as a way of ensuring that they get some money at least to survive in these very difficult economic times. Mm-hmm. We have also been trying as much as possible to sensitize our people on the need to stay safe, because at the end of the day, we'll not be talking of development if you don't have people.
Yeah.
So we have been going to the community, sensitizing them.
Yeah.
We have also enhanced the number of counselors that we have, because, you know, especially when it comes to economic stress, there's a lot of depression within the community. So we have expanded the number of counselors within the community so that they can reach out to the people, at least do a lot of counseling and advice to the people, so that at least they can establish that stamina, at least to withstand the pressure that comes along, especially when it comes to issues to do with money and so forth. So otherwise, we have an approach that cuts across all the departments. Yeah. As much as this is an healthy issue, all the departments that we have within the county are involved. We are set to roll out programs within the 10 departments that we have, of course, except the Department of Finance, where we will engage the communities, especially the youths and women, on short-term contracts, especially on road maintenance, issues to do with the environment, so that at least they can get some money. This will be short-term contracts, and these are some of the interventions that we have put in place as part of economic recovery from COVID-19. So those are some of the things that we have done as a county, beyond the health intervention measures that we have put in place.
Governor, do you have tax exemptions for people who are doing businesses there? Are there waivers that you've put in place? Yeah,
in the course of this week or early next week, we'll be meeting as a cabinet to pass some of the, of course, there are requests from the business community that we give them a waiver in terms of the taxes. So we will be passing that request either tomorrow or early next week.
Okay.
So that at least we can cushion them.
But what is the biggest challenge you face when you talk about money disbursement and food distribution to the people? There are even short-term contracts. What is the biggest challenge you face as the county CEO when you disburse the funds to them?
Now, first of all, I think it is very important to understand the challenge that we are facing as county executives. As we are talking, we are in arrears in terms of the disbursement from the National Treasury. We have not received our disbursement for the month of January, February, March, April is almost gone. I have not paid salaries. And I am expected to supply drugs to our health facilities. I'm expected to supply protective equipment to my frontline staff and even the community, and I don't have money. So that becomes a challenge in the first place. And remember, much of the fight that we have against this COVID-19 is actually within the county governments. It's not in the national government. As much as we are being facilitated from the national government, much of the work that is being done is done within the counties. Yeah. So that is a challenge that we have. And then now when we give support to the community, sometimes, of course, it means to have some small politics coming out of that, because people feel that they are entitled to money from the government. Yeah. But of course, when we are setting aside money for any program, for any activity, there's a targeted group. Yeah. So we normally have those small issues. Sometimes we also delegate these things to be done by officers within the office, or even be assisted by the village elders and the chiefs. Sometimes there is some mischief, but all the same, that does not mean what we've been doing, the interventions that we have put in place have not been successful. They have been successful. Okay. The only challenge that we have, as I've said, is disbursement. We don't have money. Yes, we have budgeted, we have set aside money, but which money do you disperse when you have not received the money from the National Treasury?
Okay, let me bring in Sylvia on this. Sylvia, and your senators are supposed to be the oversight authority. And it is true what Governor is saying, that sometimes when they put some money aside and even disburse it to the people, then they're followed by audit queries. How do we draw a balance so that they're not forestalled when it comes to interventions that are supposed to help the people?
Thank you, Trevor, and good morning again. And to my fellow panelists, good morning as well. Thank you for having me here again. And Trevor, accountability for public funds is a must. And when we are planning, and when governors are planning, or when anyone who sits in a place of handling public money must be well prepared for the audit queries or any audit requirements that should be there. Our constitution is very clear and has set up all the instruments for auditing of Kenyans' money, and therefore it is important for the handlers to prepare and to be, to use the protocols that have been set in place when they're rolling out whatever programs that require expenditure. Of course, knowing that the auditor will definitely come and check. And in fact, now we have first the controller of budget who comes to check if you have properly budgeted and how you have, started rolling out the money. Then after that, we have the auditor general who comes then to check how actually that money has been spent and to check for the accountability of it. So there is no question around this issue. And like I say, there may be red tape, there may be processes that are too long when it comes to public money, but public money must be accounted for, and there's no shortcut towards it. And Trevor, the things that ail our country around corruption and things like that. So there's no question around handling of public money. Let us just prepare accordingly. Let us know it takes time. Let us know where the gaps may be or where the challenges may be, and then you plan accordingly when you're handling public money. And this issue of public money and oversight, Trevor, last year you gave me this platform to really talk about the COVID issues when we were doing the ad hoc committee on COVID, and the issue of COVID funds when it came up. Unfortunately, by then our committee, was coming to an end, but we did request the Auditor General for a report on the utilization of COVID funds, because our expectation as a Senate of Kenya was that the COVID funds that had been taken to the counties would have made an impact that hopefully would be feeling today, especially on the healthcare system and the preparedness towards handling COVID. So, those are the issues. Where did this money, go? And it is for the Auditor General, being the instrument that is in the Constitution, to tell us. And indeed, the Auditor General did bring back a very comprehensive report, which is now being considered by the Health Committee. And, it is important for Kenyans to be able to see how monies move, from their pocket to the government, and from the government back to service them. And so these are critical items, these are critical instruments, and it's important we understand them. And for the handlers of public money, they must respect these instruments. They must give them the due process. They must give respect to the due process so that every shilling can be accounted for. And hopefully we can begin to fight this vice called corruption. Trevor, I hope I've answered your question for now.
Yeah, Sylvia, is it your considered opinion that we did not get value for money when it comes to the emergency disbursement of the COVID-19 funds to the counties?
Well, Trevor, I think I did say this severally, that we should have seen some impact on the primary healthcare system in the list. Or even, for instance, oxygen plants. Why didn't we see a lot more oxygen plants in the various counties? We are still having a lack of oxygen, across the counties. Very few have. In fact, I wish I had that report with me right here, Trevor. I didn't know we were going to discuss it, so that then I can just narrow in on some of the specifics. But if you follow what is going on at the Senate Health Committee, you can follow how some of these issues are beginning to come up. How prepared were the counties? Where are the budgets? Where are their plans? How are they planning to procure once the money, landed onto their accounts? We should have been seeing an impact in the primary healthcare system, at least an expansion of the healthcare system to some level. To some level, that impact should have been felt with the monies that were sent to the counties, if they were indeed put specifically to deal with this healthcare issue. Trevor.
Governor, what are your thoughts on that?
Yeah, thank you. Thank you very much, Trevor. And I'm in total agreement with Sylvia that we need to see value for money. Whatever money that we're injecting into any program, any interventions, the Wanjiku should have value for that money. And as much as I want to speak on behalf of my colleagues, there could also be isolated cases where money would have been misused. But I want to speak on behalf of myself and the people of Bomet. That on my side, I think what we did is evident. And you can come as much as there was a report that we were mentioned somewhere, which is still something that we are yet to clear. I can say from what we received, and from the money that we injected to some of the activities that were meant to cushion or even have a sound foundation for ensuring that we empower the people of Bomet to fight COVID-19, we did exactly that. And there were those issues, Trevor, and I want to believe this is something that they may also want us to discuss on how we use that money that we received. Of course, from the National Treasury, we received a support of 115 million. That was supposed to be used in intervention measures as much as fighting COVID-19. This money came in the month of June. We had very strict timelines. In fact, on the 20th of June 2020, there was a communication that came. Of course, following an agreement and a discussion, we had an extraordinary summit, which was chaired by the President. So on 20th of June, we were given 11 days to ensure. I think by 20th, we are only remaining around 34 counties that are not complied with the directive that we have a 300 capacity isolation facility. So on 20th of June, we given that communication. we could not also spend that 115 million without appropriating the money. So it's always very important that we appropriate. So we had to take a supplementary budget to the County Assembly of Bomet on the 24th of June, so that it can allow us to use that money.
That's 4 days later.
That was 4 days later.
Yeah.
We also changed our procurement plan, because you cannot procure without a plan. So we changed. Remember, this was an emergency. It was not something that was foreseen. So we didn't have it in our procurement plan. So we actually changed our procurement plan. Although from the report that we saw from the Auditor General, we were mentioned, one, that we didn't have procurement plan, which is not true. We have, and we have records which you can present. I don't know what, how that one was captured. Yeah. And then the other one is we were mentioned that we split the tender. And we are being accused that the reason why we did that was to ensure that we give it to our friends, which is not true. You remember, Trevor,
yeah.
There are different methods of procurement. And when it comes to emergencies, we are also given some waiver, in quotes, in terms of the channels that we can use so that we can procure whatever service, whatever goods that we require for emergencies. But all the same, I want to say that the reason why that tender was split, not actually splitting as such, I can call it unpacking that tender, was to meet the deadline, the strict deadlines. If we were to go through the long process where you advertise, it has to go through a process 21 days, advertisement, and then after 21 days, you have 30 days to do the evaluation, and then you give another notification for 14 days after awarding. So you see, that is almost 2 months.
Yeah.
We have 11 days from the 20th of June to comply with that directive. So it is also very important to appreciate the context where we are operating as counties, so that we are not accused. And from the story, it was mentioned that misuse of public funds. You know, it doesn't make sense. Maybe it would have been procedural use of that COVID money. That would make sense. Because when you say misuse, and there is something you can show that was done, and we can justify what we did, I don't think, Trevor, that should be misuse of public funds. We had strict timelines. This was an emergency, something that was not foreseen. And to me, as the CEO of Bomet, I can say the people of Bomet have been given value for their money. Because in place, I have the 300 isolation center. It is, we have oxygen in that facility. It is networked, piped, everything. And the only challenge that we have, of course, we have that huge facility. But as I was saying, if you don't have disbursement, you don't have medicine, that will be a useless facility. Because as much as we have invested that huge amount of money, for it to function and to serve the people, then whoever is serving within that facility must be facilitated with the equipment and the medicine that they require so that that facility can function. Otherwise, for me, where I sit as the CEO of Bomet, I think my people have value for their money.
Joining me in studio now is Mbithe Mwema, who's an economist. Thank you for making time, Mbithe. Are we stuck in the nuts and bolts of the rigors of our bureaucracy? Because you can hear what the governor is saying. He had 11 days to spend the money. Then comes the audit report, says the money was misused. It wasn't misused. It was an emergency. They wanted a work plan. There was no work plan because it was an emergency. How do you plan for a work plan? Are we stuck in the nut and bolts of it all and then accusing the CEOs falsely?
Good morning, Trevor.
Morning.
And good morning to my fellow panelists, Governor, and Sylvia, who's joining us online. You're absolutely right. There's a lot of bureaucracy, but I don't think we need to focus on the bureaucracy because it cannot change today. This is a government that has had systems and processes that have been working for a long time, and it's very hard to have these systems and processes change overnight, largely because of a pandemic, which was a crisis, and it was not a crisis that was foreseen. That said, I do appreciate some of the efforts that have come from the national government and cascading down to the county government. I certainly empathize with the governor of Bomet because you have an instruction and you're told to put up infrastructure, but when it comes to execution, it's a place where we fail. We don't just fail when it comes to health, we fail when it comes to other things, largely because of the bureaucracies. So I think in as much as we love to create task forces to come up with reports, there needs to be a part of the government that says, fine, you have put up the beds and you have done X, Y, Z, but then how do you fast track the element of execution? And for this particular example, how do you ensure that the government, or in particular the county of Bomet, is able to work with the local fraternities there, such as the medical service providers there, to be able to ensure that there is procurement? I think there's an opportunity with this crisis for us as a country, individuals and the government, to pause and reflect and actually take this opportunity to rethink the way we have been doing things and ask ourselves, does this actually add value, or are there things that we can start to change today so that we don't end up in the situation where we keep running helter-skelter, having institutional organizations or bodies where you have a framework, like in this case you probably have a building where you cannot provide services, and the real thing that you need to be addressing is, in this particular case, health and people walking in and being able to access services, but they're not able to because there's a bit of a mismatch in terms of execution and the thinking behind it.
All right, let's bring back Sylvia onto this. Sylvia, what would you recommend? You know, as the Senate and the oversight body, and the governor has just explained what was going on, how do you have a procurement plan for an emergency? How then are you not supposed to split a tender and you're supposed to spend 115 million within a given timeline? If you go through the normal rigors, it will take you at least 41 days. What do you do? Even if it was you as the governor, what would you do?
Okay, I also want to sympathize with the governors, because I think anyone in leadership today at a time of COVID is definitely not in a good place. But be that as it may, there's the issue of planning. Everything is about planning. Kenya was locked down. This country was locked down towards the end of March, the whole of April last year, and part of May last year. And the idea of the lockdown, if you remember those 100 days, how can we cannot forget those days. But the purpose of that lockdown, of course, was to slow down transmission, so that we can, give time to the counties to prepare. Because once the lockdown was opened, it was inevitable, without doubt, that definitely COVID would spread to the counties. So those 100 days plus, by the time the government opened up the barriers for Kenyans now to move freely within the country, what was the planning that was going on at the counties? Because there was no question as to whether COVID would reach there or not. It was a question of when it will reach there. So I would be curious to know what kind of plans then were being put in place in preparation to handle COVID cases, because they were definitely going to come to the counties. And I think that is where, when we were in the ad hoc committee and even Senate right now, I think in the health committee, those are the things we are trying to grapple with. When the governors say it is an emergency procurement in probably September or August, September, I think after the funds had gone, what was happening between April and September by the time, or April and June, by the time the funds came in? Those are the questions. A question of planning. Everything is about planning and preparation, and especially because, we've seen other countries. We had been watching other countries, so we were also saying even the national government should have probably been better prepared. Those are some of the conversations we were having last year. And so now here we are today wondering then how prepared were the county governments, or are the county governments, considering now the county governments are bearing, the weight of COVID as it was anticipated. So planning for us is the key question when the governors sit and, in their panels. So Trevor, this is the thing. This is the thing that we are grappling with. And I think that is why the conversation on the utilization of funds then comes to the fore. because we are wondering, by the time the funds got there, how can you talk about emergency, yet you had months before to prepare for the inevitable and just waiting, for the funds to land in the bank accounts. But I'm sure every governor will have, of course, their day. And as the governor says, there are isolated cases, there are some, extreme cases, and there are some cases that are not so extreme. Some are to do with, again, procurement issues, the ones that we know in Kenya, like the governor has said there. Others are to do with even just planning the budgeting of those funds, and others completely diverted, the funds from COVID to other projects.
Yeah.
And, those are now the issues. Why use that money for other things? Because it was inevitable that COVID was going to come, to the county. It should have been used specifically for that, or in the list, just put it in the healthcare, put it in the healthcare system. Let us revamp the healthcare system. Let's get that battalion of healthcare workers. If you didn't have any other project, at least, direct that to the healthcare workers or something like that. So these are really the questions that Senate was grappling with and still is grappling with.
Yeah, Governor, why didn't you plan? Because I know more than 3/4 of the counties they have been are being grilled right now. Busia was one of them. Another issue they were dealing with was 103 million shillings spent without a plan and 109 million spent late. Why didn't you plan for this? You knew it was coming, right?
Thank you, Trevor. As much as I want to agree with Mheshimiwa Sylvia, but I don't think it is actually true that we, as county executives, we sat back and waited for a disaster to happen. There was a lot of things that were happening. We used to have a committee that was chaired by the county commissioner and the governor. And for our case, we used to have our meetings every Tuesday. And there are a lot of planning that went on. And there were so many interventions that were put in place. We actually reorganized our budget to accommodate the challenge that we are facing and the challenge that we are still facing. We prioritize health. We remove money from other departments to ensure that we have medicine in our facility, to ensure that we have PPEs in our facility. But I want to narrow down to this one specifically because this is where we have issues, especially touching on isolation centers. This money was disbursed in the month of June.
Yeah.
And you cannot plan for money that you don't have. You have to wait until money is released. The resolution came because of the meeting that was chaired by the president. And it was within 1 month. So even if we were to run for 30 days, it would not have been possible for us to plan, go through the long process of procurement, and ensure that we have an isolation facility within 1 month. So if the money came in the month of June, we did the supplementary the same month within the month of June. In fact, we published our Appropriation Act on 1st of July. So we didn't even spend that money within the month of June. It was after June, that was in July. That is when we started spending that money. So that is why I'm saying we need to understand the context under which you are working as governors.
Yeah.
Otherwise, we'll be carrying all the blames, and I know as much as I've said, we have that responsibility as county executives. It is also good that we are understood in terms of the context in which we are operating.
Yeah.
Money is given in 1 month. You have to spend that money within 1 month to ensure that you set up a facility that accommodates 300 beds in 1 month. And I've said on 20th, we had only 11 days to comply with that. The money had not been appropriated. It was only after 4 days that we did that and published our act in July. So I cannot plan for money that I don't have.
Yeah.
In the month of May, we started planning, and that is why we have said we prioritize. We took money from other departments to health to ensure that we have PPEs in our facilities, to ensure that families that were fed we actually did that, and even changing our procurement plan. Even this thing of being accused that I didn't have procurement plan, even for this isolation facility, we did. We have the procurement plan. It was changed because you cannot procure. It's against the law. The only thing is, in the procurement law, there are also room for emergency procurements.
Yeah.
So I think the law had foreseen that there could be instances where we want to procure in instances of emergencies, and that is what we took advantage of as the county executives.
All right.
So we didn't sit back to wait for a disaster to happen. We planned.
Okay.
And we worked with what we had in the month of May.
Yeah.
When this money came in June, we also did what was supposed to be done to ensure that we have that isolation facility.
Okay. I have to take a quick break here. Bide, I'll come back with you and then you'll let us know at this point, what do we do now? How do we inject money into the economy? Is cash disbursements a sustainable way of doing it? What do we do from this point, considering that many people are suffering? Keep your views coming at Trevor Mbidi at Citizen TV Kenya. Use the hashtag Daybreak. We'll see you in just a bit.